Alright guys, I got about 5 minutes with you. So my name is Joe Vaughn and I graduate in 8 months. I'm here today to talk to you about something that we all experience but never really talk about.
You wake up, take a shower, get ready, try your best to hide your road rage, go to class, probably not pay attention, go to clinic, do an amalgam, go home, go to sleep, and then get up and do it all over again. This is our routine. We get lost in it. After a while, you become numb to it all. It may start with subtle things. You stop smiling when greeting your patient. You may not listen so closely to their stories anymore. You go to school, you get your stuff done, and you go about your way. You become less like a person and more like a machine. And then you become exhausted. You all of a sudden realize you've been sitting in a chair, staring at a wall, and you don't even know what you've been thinking about for the past 2.5 hours. Honestly, it can get scary. It's easy to imagine that in the middle of all this mess, you can make bad decisions. But what I'm talking about now are the professional decisions, ethical decisions. And I know what you're thinking. We're all so confident that we know how to act, and we act how we're supposed to act. We read the news stories about the nightmares that give our profession a bad name, and we shake our heads at how ridiculous it all seems. But there's much more going on here, and what I'm talking about are the gray areas. What we wake up in every day as dental students and as dentists.
If you don't know what I'm talking about, you will soon.
Conversations on filling materials, treatment plan recommendations, issues on whether to get out the high speed or just watch it a little bit longer. It's what we all experience but don't talk about. It's the risk we have of giving in to the long, tiring, stressful life of a dentist, the day in and day out. The risk of seeing your patient as something other than a living, breathing person with their own thoughts and feelings and wants. You'll look at what's sitting in your chair and you'll see a requirement, a grade, a competency, a paycheck, anything other than what it really is. But when you face these situations, these moments that claw at your core, I want you to stop and I want you to remember that college kid stuck in the corner of the library, putting in hours of studying to get here. Remember the person you were, nervously sitting in the middle of the biggest interview of your life. And then that inevitable question comes up. Why do you want to be a dentist? To help others.
To help others.
Imagine if this patient was someone else, your mother, yourself even. Of course, everything I'm saying to you right now, you've all heard before, you've seen before, you've read before. It's something we all know, but don't talk about. Hold on to what's true and good. Without you, it's just a book. It's just a bunch of pages and words without meaning. Remember who you are and what's important and why you did all of this in the first place.
Be the doctor you were always meant to be.